Hello, everybody. It's Anne Duffy, and welcome to Dental Entrepreneur, the Future of Dentistry's podcast. I am so happy that you're here, and I have a return guest, which I'm very excited about. We just realized that it was 3 years ago that we did a podcast. But before I get started with this amazing gentleman, I'm going to tell you a little bit about him. Dr. Eric Block is a full-time practicing dentist, a serial entrepreneur, advisor, key opinion leader, and investor, passionate about helping dentists become more efficient, productive, and less stressed. He is the co-founder of the International Academy of Dental Life Coaches, and we're going to give you that website in our notes. He is a wellness ambassador to the ADA and the former chairman of the Massachusetts Dental Society's Health and Wellness Committee. He hosts the Stress-Free Dentist podcast, show, and Facebook group. He is the author of a series of nonfiction and children's books, which can be found on Amazon. And we'll have to check that out. That will be on our show notes as well. So check out the Stress-Free Dentist for the upcoming events in the future. Dr. Eric Block, welcome back to the Dental Entrepreneur Future of Dentistry podcast. It's nice to have you.
Oh, this is great. I can't believe it was 3 years ago that you had me on. Time flies.
I know it. Time does fly, but that's good. I mean, I guess the more fun you're having, the more time flies, and we must be having a good time. But I want to know, because I was reading your article. In fact, if anybody wants to read the article that was in our spring edition of Dental Entrepreneur, please go to dentalentrepreneur.com. Dr. Eric Block's articles are always well thought out, and I love getting them in my email box. What sparked you to be a dentist? I mean, and to get into dentistry? Because, I mean, you've got so many things on your list of things that you like and you do in your life. But what sparked the dentist in you?
Yeah, I'm actually from Massachusetts. I went to Tulane University down in New Orleans, not thinking I was going to be a dentist. One night I was at a bar and I just missed my mouth and I broke my front tooth, number 9, on a beer bottle, and it broke in half. And I went to a local dentist in Metairie, Louisiana, based off of the referral of a college friend. And I just loved the way they took care of me. They patched me back up, gave me my smile back. And I said, you know what, maybe this is something I could do. And I started looking into dentistry and took all the prereq classes and the DATs. And I actually did this kind of late in my college career, so I had to take a year off. I taught tennis and took the DATs and some classes that I had to take. Then I applied to Nova Southeastern, which is down in Fort Lauderdale. Mm-hmm. I got in there and I went to dental school down there, which was great, and graduated in 2002. And then I did an implant residency at Boston University and graduated there in 2004. And that brought me back to Massachusetts, about 30 minutes west of Boston, in a town called Acton. And I've been practicing and living here ever since.
That's so cool. It's interesting how that's a story that many dental professionals have. They either broke a tooth or had some major dental catastrophe when they were a kid, and it led you to dentistry. But did you think it was going to be easier than you found it to be when you got started?
No, I really struggled through dental school. I did okay. I graduated and did well on my licensing exams, but I knew that I wasn't ready or mature enough to go and practice dentistry right after dental school. So that's why I ended up doing the residency. And I needed those extra 2 years to get some more maturity under my belt, get some more clinical skills under my belt. And then I still got into the real world and found it to be very challenging. In fact, about halfway through my career, I went through a tremendous amount of burnout, full of stress and anxiety. And I actually thought about leaving dentistry. And, some will call it a midlife crisis, whatever you want to call it. I was really regretting my place in dentistry, and I was looking at other professions. In fact, I was looking at law school because I wanted to flip the script and be the one doing the suing, because I was so anxious and worried about getting sued. I was so worried about what people thought of me. And I was really becoming more and more introverted and going into my own little shell and avoiding conversations with patients and staff members and just not enjoying myself. So I actually thought about leaving, but the reality was that I was still in major debt. And I told myself that you got to take some action here. And what I left out about my origin story was that I actually graduated Tulane with a degree in psychology. And I always knew that at some point I wanted to go through therapy. And I finally picked up the phone and called a therapist. And I just met with them once every 2 weeks. And they were just a local therapist. They really didn't know anything about dentistry other than, they were a patient at another dental office and that was their own experience. So I just went in there and just we dug in deep to my childhood, and we really figured out, why I was so stressed and anxious in dentistry and why I was so burned out. And it was all up here. It was me just being too difficult on myself, me putting too much pressure on myself, me trying to be everything to everyone, and then me putting myself last. And I learned a lot, and I learned not to beat myself up when things don't go great. And those days are going to happen. There's going to be ups and downs. And this profession that we chose, dentistry, is not easy. It's a difficult profession. And
Yeah.
it's really a marathon, not a sprint. And I really learned that there's nothing wrong with me. I'm, more of an introverted person, and the social aspect of the profession was really hard on me. The going from room to room to room and working on my patients in my operatory and doing dentistry and giving that patient the best experience. Sometimes that was exhausting. And then I'd have to hop into the hygiene room and do 5 hygiene checks and then bounce back into my room. And over a course of an 8-hour day, that was exhausting. And when you add that up week after week and year after year, I was really putting a lot of pressure on myself. And therapy was one of those things that I wish, this is the future of dentistry. If I could go back to young Blocky and tell him to do anything different, it would be go seek out the help of a therapist or a life coach or anyone that could help you mentally earlier. So that's really kind of my story. And then after COVID, I decided to write my first book called The Stress-Free Dentist. And that was just me wanting to share my story of how I overcame burnout and actually got back to the point where I love going into work every day. And I felt like if I could help a few dental professionals out there, it was worth it. And from there, it led to other books and to the podcast and Facebook groups and me doing speeches, and just kind of took on a whole life of its own. So it really started with picking up that phone and calling that local therapist and getting myself the help that I needed.
That's being so brave and courageous and vulnerable to share your story. Because, I think of Eric Block, Dr. Eric Block. I just met you a couple years ago, probably 5, 6, 7 years ago. And I thought, oh my God, he's so cool. He's got this book and he's just got it all together. And we do know that dentistry, and I'm a retired practicing hygienist, but for you dentists, it's got to be tough because perfection is what you are taught in dental school. And then you layer that on with, like, if you're an introvert, like I'm a woo, so I loved having a new patient every day or every hour. I mean, that was the joy of my life in the profession. But until you said that, Eric, I don't give that much credence, because when you apply to dental school, they don't ask you if you like people. They just really want to know how your grades are. They don't even do anything with dexterity anymore. I mean, they used to give you all these rigorous tests that you had to get in, but it can really throw you for a loop if you don't get some help and find what is it that you like about dentistry now, because you still have to hop from room to room. So what was that shift like? And tell us about that, because I'm sure there's somebody listening here that is like feeling your pain.
Yeah, actually, and I also want to mention that, hygienists can also go through this. Hygienists and dentists, we go through this path. You apply to school, you try to do well, then you have to pass your licensing exam, and in school, you're surrounded by peers. And also, if, let's say you don't pass a test, you study harder and then you retake that exam. When you get into the real world, there's no redo button. You're dealing with real human beings, and it's in a business. And it's just a total different world. You no longer have that instructor leaning over your shoulder. And I think as dentists and hygienists, we get our first taste of failure when we're in the real world, especially the students coming out now. All they've known is success. They aced all their exams. They did well in school. They aced their DATs or hygiene exams. They did well. And now they get out into the real world and they got a bad review, or they have a patient that's upset at them, or there's a staff member that is not treating them well. And this is the real world, and we're not used to that. And I think that's a major issue. And then there's the issue of perfectionism, where we're taught to try to be perfect. We're taught to talk over the patient or talk about the patient, and it's just not realistic. And we get into the real world and things don't go according to plan. We're sitting right next to this patient, and we have to make a connection with them and give them this great experience. I think oftentimes dental professionals can lose their way and the stress can build up. And luckily for me, I didn't turn to drugs or alcohol. We've all heard the statistics, suicide. I caught my problems early enough where I was able to turn them around. And, now I really love going into work, but I understand that there's going to be stressful moments. That's what the stress-free dentist mantra is. It's not that there's a way to totally get rid of stress as a dental professional. It's just not realistic. the only stress-free dental professional is the one that's retired. It's a stressful profession, but it's how you deal with the stress. It's the understanding that there's going to be good days, there's going to be bad days, there's going to be bad experiences with patients, there's going to be bad reviews, there's going to be uncomfortable conversations. But that happens to every dental professional in the history of dentistry in the world. I'm not the only one. To me, just understanding that and understanding how my personality, what makes me tick, has helped me so much. And I've, through experience, started to learn how to talk to patients better. I still struggle every day with communication and being a leader. I wish, this is the future of dentistry, going back and telling young Blocky, don't take that 16th course on bone grafting or bonding. Take it on how to communicate, how to lead, how to deal with uncomfortable conversations. But I've gotten so much better at those things. And to me, that has really reduced a lot of stress. And I also reach out, engage with peers, and I'm constantly reaching out to experts, to life coaches, to therapists, to consultants, because I know that burnout can easily come back. And it's a battle that as dental professionals, we constantly have to wage. But I love technology. I love the fact that we're in a business. I love wowing patients. I love having a good time and understand that there's going to be some bad times, but I don't harp on the bad times anymore. I used to focus on that one bad thing that happened and I couldn't shake it. I would be thinking about it all night, just the one negative thing that happened. I no longer do that. And I now focus on, the 20 good things that happened. And to me, that's been, really freeing. And, I really look forward to going into work. There's days I come home and I'm just like totally exhausted and have to stare at the wall when I get home. But hey, these things happen and I go back tomorrow and try to have a better day. So that's really my philosophy.
Wow. It sounds simple, but it's not easy, right? And that's why I love the fact that you're not finished with your getting coaching yourself, reaching out to experts, learning as much as you can, having that mindset. You have to count your blessings. And there's so many, like a mantra there that you've got down. And they should give the stress-free dentist to every dental student in the country. And then your message also of don't just take another implant course, if you will. Learn a little bit more, because dentistry, such a big part of it is the communication, not only with your patients, but with your team, with the patients' families. And then you got to come home and you want to have a good life. And you certainly don't want to bring all that crap home with you. That's not fair to your family. But sometimes you just don't realize it's just a little shift up here. And I think that's something so valuable for someone to learn, to know that there's an answer for their misery, if you will, or their burnout. Were you just lucky to get your first therapist? I mean, if somebody's listening to this, I don't know where to start. How would you start finding that right person?
I just picked up the phone and I looked on Google and found a local therapist, and she turned out to be a great fit for me. Mm-hmm. Now, I've heard that, and this is also very common in coaching and therapy, but you may not hit on the first one. You may not connect with that first therapist or life coach on the first one, maybe not the second one. Maybe you do on the third one. For me, it hit. And this mantra that I've developed didn't happen overnight for sure. Mm-hmm. It really took me about 6 months to a year before I started to really not have those voices in my head. There was also a mixture of therapy. I was able to connect with a therapist that was able to prescribe medications, and we added in some prescribed medications for me. And we found that right mix, and that going into therapy and talking it out. And all of a sudden, maybe after about 6 months to a year, there was this absence of that negativity in my head. It was like my head was just more clear. And that negativity and that focusing on the one negative thing that happened during the day that I couldn't shake, all of a sudden it just started to go away. And when you can do that, when you can remove negativity from your life, you just open up your brain to be more positive, be more productive. It's such a great feeling. It doesn't happen overnight. I knew that I'd always wanted to go through therapy, being a psychology major.
Yeah, that's cool.
But I know a lot of dental professionals out there don't know where to turn. That's why Dr. Laura Brenner and I co-founded the International Academy of Dental Life Coaches, because we wanted a place for dental professionals to go to seek out the help of a life coach that understands dentistry. Because, my therapist was great, but she didn't understand anything about dentistry. And I would go on this long rant about the assistant, the hygienist, the patient, and she'd be
the margin.
She'd be like, so what do the hygienists do again? And so there was that lack of understanding of how complex this industry is. So that's where the IDLC comes in, is we'll match people up with a life coach and get them the help they need. And, life coaching is very different than therapy in the fact that, with therapy for me, we really dug deep down into my childhood and really, my growing up and how I became the person that I am. And we added in some medications. But with life coaching, it's really focused on the here and the now and the future. And it's about the coach, guiding the dentist or hygienist to asking the right questions. We all have the answers within us. And it's really about guiding that client to finding the answers within them. And it doesn't mean you have to be depressed or anxious or really hitting rock bottom. You just may be stressed, or you may be doing great, but you just want to get to that next level. That's where a coach comes in and can really, help guide you. So for me I got lucky with my therapist, but sometimes it takes a few tries to click with that coach.
Well, referrals are great. I mean, as people closest to you. And I love that you've created this space of the International Academy of Dental Life Coaches. Couple of reasons why. That common thread of knowing dentistry is so valuable. And we found that with we don't care. If you're a woman and you happen to have a toe dipped in dentistry, please join us, because that thread is really important. You almost have to be in the trenches, no pun intended there with dentistry, but you have to be there to really understand the mindset of what you went through with all those years of schooling. There's not a dentist that graduates or a hygienist that graduates that's not smart, because you can't get through the curriculum without it. But those life skills, they don't come that naturally to very, very many people, and especially when people don't want to come see you. And you hear that day in and day out with dentistry. So I love that you've created that for a resource. And of course, we're going to have that in our show notes as well, so they could be able to get in touch with you. And I also love the fact that you've, in your article, which I really enjoyed reading, the difference between therapy and life coaching. Like the therapy is the past, and sometimes you do have to start there. I was just on another podcast and we were talking about, those gremlins that you get when you're growing up, and, parents do the best they can, but we're not perfect. And we try to do the best for our kids, but sometimes the gremlins are there and unbeknownst to us until something explodes or what have you. But I think it's more prevalent now, and it's not like it's cool, but it is effective. And I think therapy is definitely, would you say that it's more mainstream than it has been in the past? Used to be you would be embarrassed to say, oh, I'm going to a therapist. You're like, well, what's wrong with you? But now it's like, yeah, that's smart. That is just smart living.
I think there's definitely more awareness about mental health in general. And I compare putting your mental health last and pushing down negative emotions, like pushing a volleyball deep under a pool. What's going to happen? Eventually that ball is just going to explode and pop up. And I think men are not great at this. We push down our emotions deep down inside. And before you know it, you could be getting totally burnt out and start, heading down the wrong path. But I think there's definitely more awareness now. And, I compare therapy to, like, we go to the gym, we work on our biceps, we do yoga to get more flexible and stretch. Well, going to a life coach or a therapist is like yoga for your brain. It's so important. And especially in dentistry, where it's so complex. And if you think about it, this is such a safe industry. I mean, you just don't hear of a dental office going out of business very often. So dental offices, they survive and often thrive, but they can survive even in not great conditions. So if staff's not getting along, or there's improper systems, or no one knows their role, or not proper protocols, they still can do well. And you're in this little bubble of this private practice, and sometimes it's not a great culture, and you're dealing with patients that are nervous. They're paying a lot of money and you have sharp things in their mouth. It's very complex. Reaching out to your peers, coaches, consultants, mentors, it can be, multifactorial sometimes. But, as I always say, sooner the better you reach out for help, the better, but better late than never.
Yeah, I would agree with that. But the other thing that I wanted to touch on that you said is, I think the reason I love what you're doing, Eric, is especially with the community that you've built with coaches. I think that dentistry is so isolating in your own operatory practice. It's not like you want to tell your buddy down the street that also has a dental practice or is in your circle in your town that you're having all these problems. I mean, you kind of keep it to yourself and just hold a good face. It's just great, though, when you can find a community like what you have developed that is safe for them to reach out to, because the problems they're having in Timbuktu are the same thing you're having in Boston. Basically, the practices run, treatment is pretty standard across the country, to have a healthy smile, if you will. So I think it's just great to be able to have this opportunity for them to reach out and get the connections that they need. Also, who has ever listening to this, the future of dentistry, because we've got dentists that are listening to this that are practicing, but we've got entrepreneurs and you're an entrepreneur and that's a roller coaster. That's another mindset shift that you need if you're an entrepreneur. You got to be able to bounce back from the no's and this isn't working and I threw this against the wall and stuff. There's so many different areas that you're involved in that I think you could be able to find somebody, the right coach for the right problem, and then have a great life. Like you said, I mean, sooner than later, because, life goes by pretty fast. And your goal, my goal is for them to look back and say, hey, that was a great, fulfilling career. And I love that you didn't give up on dentistry, Eric, because you spent so much time getting prepped for it, getting ready for it, and you have the heart for it. You just need a little mind shift. And I think, gosh, you're pretty special, but I think if you're listening here, if it can happen for Eric and he can find joy in his work and joy in his life, because if you're not happy at work for your 8 hours a day or 9 hours a day or whatever that is, you're really going to have a hard time being happy in life. But if it can happen for Dr. Eric Block, it can happen for you if you're listening. So Eric, how do we reach out to you? How does anybody reach out? I'm sure it's a confidential reach out. So how do we find you? We'll have it again in the show notes, but please let them know right now if they're listening.
Yeah. And the other thing is the IADLC. I can always reach out, info@iadlc.com, is also a community for life coaches. So if there's someone that is a life coach or wants to get into life coaching, often people that went through coaching want to become coaches. And it's such a great either side career or second career to get back, stay within the industry and become a life coach. But anyone can reach out to me. My personal email is ericmblock@gmail.com. You can also check me out on thestressfreedentist.com. I'm also on LinkedIn and Facebook. And check us out at the International Academy of Dental Life Coaches.
Thank you so much for being with us today. I can't wait for this podcast to be released and to get out there because you just gave me a lot of hope today that I love our profession. I love dentistry. I love what it does for our patients and for me personally. I just think it's going to be great because it can be great for anybody that's listening. We got to just get a little shift and get some help from our friends. And that's what you're giving. So thank you, Eric, Dr. Eric Block, for being with me today. I'll see you on the road, I'm sure, at a meeting soon. Good luck with everything that you're doing. And if anyone's listening, remember to keep doing you. Thank you. And we'll see you next time. Bye-bye.